Good morning. My name is Carolyn Harshman. I'm the second vice president of the International Association of Emergency Managers. We are delighted this morning to welcome all of our panelists and participants to IAEM's webinar hosted by our Disaster Cost Recovery and Finance Caucus. IAEM maintains more than 20 committees, caucuses, and ad hocs in a variety of subject areas. The Disaster Cost Recovery Finance Caucus routinely meets on a bi-monthly basis to review federal regulations and audits relating to disaster cost recovery. All of the IAEM webinars are recorded and posted on IAEM's website landing page. The posting for the caucus's webinar also includes a frequently asked questions document that reflects questions and answers from similar COVID-19 webinars conducted earlier in April and May. Your registration information will be used to issue a certificate of attendance. Today's presentation format will allow for statements from our panelists and questions submitted through the GoToMeeting chat function. Welcome, and let us begin.
Good morning, ladies and gentlemen. This is Mike Martinet, and we're delighted to have you with us again this morning. Real briefly, I want to update you on the revised handouts that are accessible on the IAEM website. The document's grown. FEMA continues to release fact sheets, policies, clarifications, and statements, and so on. And so it's now just over 130 pages. So I created an index which would be on the second page. I'm going to highlight just the stuff that's new in this version of the handout. On page 3, there's a just released document from FEMA, COVID-19 pandemic operational guidance for the 2020 hurricane season. So if we weren't having enough fun with COVID, now we're going to lay over tornado and hurricanes and other disasters. So it's a rather lengthy document. So I only put on the cover page, the executive summary, the purpose, and then the index of the document. Then on page 9 is a new coronavirus pandemic medical care costs eligible for federal assistance. This is a FEMA policy. And this would be a little more than a fact sheet. So this is an update. And then on, let's see, page 20 is the coronavirus pandemic alternate care site warm sites. So these are sites that people might set up to house people that need quarantining, and so information on that. And then I reorganized the document and I put all of the procurement related documents at the end of the document. So if you share this with somebody in your purchasing department with your agency, everything's clustered together beginning on page 99. And that goes for about about 30 pages of documents. And the procurement stuff is extremely critical. While they've given us some leeway for the exigent and emergency circumstances, there are still issues of compliance with Title II of the Code of Federal Regulations, Part 200. So those are addressed all at the end of the document. And with that, I'd like to introduce today's panel. We have returning with us from AG Witt, Bill Riley, and I could spend the rest of the hour talking about Bill's experiences, but I'm going to short circuit it to say he's got over 40 years of experience, a great deal of it with this cost recovery process. We have Jerry Quinn. Delighted to have Jerry with us today. And Jerry has been almost as long, maybe longer. I wouldn't want to get into a term of office fight with these two guys. Jerry, I think, has got at least 35 years doing public assistance, and Jerry and I share a common disease. We both love this cost recovery stuff. We find it fascinating. And then we have Chris Terry, who's a manager with forensics at Ernst & Young. And Chris is standing in. As you can imagine, many of the consulting firms are just beyond themselves busy supporting clients. And so Chris is first time with us this morning. So what I'd like to do is I've got 3 topics that I want to talk about, and then we'll get to your questions and answers, or your questions are answers. And so starting with you, Bill, and then we'll go Jerry and Chris in that order. Some people are dealing with the issue of signatures on documents, particularly source documents like the ICS 214s or other source documents that track your daily activities as opposed to your time cards. And they're wrestling with the issue of wet versus electronic signatures. I know of one agency that in 2017 adopted an e-signature policy, so they got something to go on. But Bill, if you talk about this issue and what's FEMA accepting, what are they expecting, and so on. Bill?
Thanks, Mike. Well, I think on an agency by agency basis, it's all over the lot as to what's being accepted and what's not, and that not just at the federal level, but at the state and the local level as well. So as we begin to adapt to some of the new requirements that are being imposed upon us by COVID-19 in terms of working remotely and accomplishing things a little bit differently than we have in the past, I think there's going to be a little more leeway in terms of the use of wet signatures. At least that's what our experience has been, and that for the most part, electronic signatures are being accepted, but there are some exceptions to that. And I wouldn't begin to try to list who is accepting and who not, but it's going to be very much on a case-by-case basis.
And Bill, in your opinion, should they check with their state OES or OEM or their FEMA region to determine?
Yes, Mike, I think it's always best to start with the state as the grantee and see what they're accepting before moving on to the region, because what the region is in a position where they may not have the most up-to-date information about what a state is accepting or not accepting. There's a lot going on right now. There's a lot of moving pieces, and because this is unprecedented, where nearly every eligible applicant in the country is in a position to be seeking disaster assistance from FEMA and from their state agencies. It's very difficult given the imposition of time and resources being imposed on the state agencies and FEMA. It's difficult for anybody to really keep up with what's going on a day-to-day basis. So I think the best place to start is always with your state emergency management agency, working with the folks that you've been working with right along for many years and getting the first answers there.
All right, thanks, Bill. Jerry, any add-ons to that?
I would agree with most of that because for the reason stated, we really don't have much of a choice. What I'm having my clients do is I'm having an executive level manager put out a written instruction as to how, in the absence of physical proximity, people are to document their time and how it will be then signed off by a manager. And in some cases, it's being done weekly, some cases by department, and then covered at some later date whenever anybody's able to get back together with some wet signatures. And I like the advice of going to the region eventually, because it gives us the defense with the OIG that we followed FEMA's instruction. And I think that's going to be a big issue because not only are we in uncharted ground, but so's the OIG.
Very good. Chris, any added thoughts there?
Yeah, I definitely echo Bill and Jerry's comments. Definitely, check in with, what the local and state requirements are. I think the more that you can, if you don't have a process established already, definitely, try and get ahead of that, get something on paper so that if someone does come in later, you're able to say, hey, this is our process and we followed it.
Excellent. The next question I want to address, I'm seeing confusion out there with DAC, direct administrative costs, versus CATZ funding. And some people are seeing these as identical concepts. And Jerry, you want to start the parade on this one?
Sure, and there's plenty of reason for confusion. Relative to COVID-19, we have both FEMA's interim guidance as a result of DERA 218, but they're also applying the Papa G dated April 2018. So it's not contradictory. The FEMA's DRA 2018 instruction supersedes the Papa G dated April 2018. FEMA, of course, is indicating they think this is simpler, but given the grounds for confusion and how many events people are handling, I think the confusion will reign. The consistent measure is you still have to document what you're doing that meets the definitions of either a direct administrative cost or category Z management costs. So that's the common denominator, and it can be labeled later as this settles down. And as you deal with any number of PDMGs from FEMA who have their individual interpretations.
And Bill, just for the record, what was the difference between DAC and CATZ for people? And then what is it today?
Well, it's really, I think, a very confusing topic for most people. The DAC is actually captured and reported to FEMA on a CATZ project worksheet, and a CATZ project worksheet is often interpreted as being strictly for the reporting of administrative costs. When actually, if you go back through the history of the CATZ was a catch-all category that but primarily used for the reporting of both 324, the old 324 management costs and direct administrative costs. But I want to echo Jerry's concern about the proper reporting and the capture of information for direct administrative costs, because what we have seen is some applicants not properly capturing, and some consultants not properly capturing the detail that's required by FEMA, and kind of generalizing the information that goes in. But you really do have to provide the date that services were performed, the tasks that was performed, the specific steps that were taken to perform that task, and the project worksheet that was associated with that.
Excellent. And John, any final comments, thoughts on that?
I think that was for me, for Chris. Yeah, definitely. I think we see time and time again that folks just maybe don't do the best job of tracking all of these activities. So definitely all of those things that were just listed. And I think going back to the discussion about DAC versus CATZ, I think that the biggest distinction here is that management costs would also capture indirect costs, as well as direct administrative costs, and really any other kind of administrative expenses that would be associated with that project worksheet.
Okay. And let's reverse the order on this one. Start with you, Chris. Realizing that from state to state, or even FEMA region to region, as we get into the later summer, if there seems to be a chance that there's going to be a resurgence of COVID, particularly if schools go back in session, if sports events start up, and you know, things start to loosen up, and then there's a extension or a resurgence of the COVID. How do we want to file the time extension request with FEMA? Because the incident period ends mid-September, and you've got 6 months to do emergency work, and that'll run out in mid-September. So what do we need to do to protect ourselves if there isn't an automatic, you know, countrywide extension done by FEMA?
Yeah, great question. I mean, I think the best thing to do is start asking questions now and coordinating with, you know, your state emergency management agency. You know, the process does vary from state to state. Some states are still operating under a paper process, where others, you know, you can do it through their grant management system, or even possibly through grants portal. Yeah, I think you know, those are the big ones. So, you know, just kind of start asking the question now and figuring out the best way to do it. In some cases, what we've seen, you know, I've seen this in primarily in the Caribbean, is the state management agency can actually ask for a blanket extension for all Category B projects for you know, all of the subgrantees that would, you know, be under their purview. So in some instances, the subgrantee wouldn't even have to make the request themselves. The state could do it on their behalf.
Okay, Jerry, anything else that would?
Yeah, one of the things that's really important about time extensions is you need an approved project worksheet in your hands to do one with. And if you don't have an approved project worksheet by the 6-month mark on this declaration, you don't have the ability to submit a request until that project worksheet is in your hand. So that argues for getting some project worksheets approved if it's prudent and if you can do it. But that's one. I've seen way too many requests go in and get bounced back saying there's no project worksheet to tie your extension request to.
And Bill?
Yeah, I think the you know, the operational word here is going to be flexibility, because the situation we're looking at, we could see a second peak in this first wave. We could see a second wave that comes along later. I think that FEMA is going to need to be flexible in their approach to this, and that we all need to be aware of things changing in a very fluid situation, where an incident period may be extended, and where FEMA may take steps to issue blanket time extensions for the reporting of costs and for the completion of the work. So I you know, I don't think any of us can give a real good answer on this right now. I think it's going to remain flexible and remain fluid for some time to come. And I think we're going to need to stay in touch with our state emergency management agencies and get the best guidance we can from them and from FEMA. I am also concerned that you know, the ability to get a project worksheet out of FEMA is going to be a challenge because of the sheer number of applicants that there are, and the workforce that FEMA has available to process all of this. We've seen FEMA project worksheets being produced, particularly in California. But you know, my fear is that at some point there's going to be so much work on the table that there may be some further delays that FEMA is going to have to address.
Thanks. We have at the moment 0 questions to address. So pending the arrival of some of those questions, what I'd like to do is ask each of the panelists, what's the number one thing you have seen that causes you concern on this COVID-19 currently? And Bill, let's go back to you first. So the number one problem you're seeing with clients.
Well, I think the number one issue that's out there right now that we have seen is a coordination of the different benefits that are available from different agencies through the CARES Act and also from FEMA, and what is going to be considered a duplication of benefits and what will not be considered a duplication of benefits. And I think it's important to, what I like to do is I like to draw a comparison to sometimes the denial of funds on the basis of duplication of benefits when you're up against a cost that might be covered by the NRCS. And FEMA has often taken a position that if you didn't apply for the NRCS monies, tough luck, we're not going to pay them because it would constitute a duplication of benefits. And I think we run the risk of running into some of those type of issues with the CARES Act. But I think what people need to keep in mind is that the CARES Act provides general authority for the payment of expenses associated with COVID-19. And FEMA provides specific authority. So much like in the case of NRCS, there's only a certain finite pot of money to go around, and there are certain things that will be eligible and not eligible under the CARES Act. Whereas many of these expenses might also be eligible under FEMA at perhaps a different cost share. So I think that we have to be strategic about how we apply for the funds under the CARES Act and weigh it against what is eligible or potentially eligible from FEMA, and then be very careful in our documentation and be ready for an issue of duplication of benefits to come along and be raised by FEMA when they're reviewing the project worksheets.
Very good. Jerry, what's the number one thing you've seen that causes you concern?
The number one concern that I'm seeing is those clients that will not reach the large project threshold and how they get their cost estimates revised at some later date. The large projects have the version request available to them. That is not at the moment one of the tools in the toolkit on small projects. The only tool in the small project is to file a net small project overrun appeal. So at the moment, many of my clients are holding off and building up a bigger number. And I have at least 2 clients that are estimating costs out to December 31st in the hopes of having a big enough number that they do not have to file an expensive appeal later on. But I think Bill's right that FEMA's going to have to make some adjustments in that process along the way.
Okay. And Chris, what are you seeing that's troubling?
Yeah, absolutely. So I think 2 big things. One, because of just the magnitude of the total dollars that the federal government is pumping out in this, these dollars are definitely going to be at higher risk for fraud, waste, and abuse. So I think they're going to be heavily scrutinized by auditors that come in after the fact. So making sure that folks are paying attention to things like duplication of benefits, or making sure that they didn't buy more than what they needed, and they're trying to get reimbursed for the whole thing. The other thing I think that caused a little bit of concern is, I think FEMA's done a pretty good job of issuing supplemental guidance to what is what would be considered eligible category B work. But I think those there's always a disclaimer attached to those, that those lists aren't all inclusive, and there could be other things out there. So I think just really asking the question, if you think there's something that at a fundamental level is, achieves the purpose of what FEMA would be willing to consider eligible under Category B.
Excellent. Okay, we've got a couple of questions. Need some more, but we got a couple. Will FEMA cover setup costs and costs of quarantine isolation sites before they are occupied? Jerry, you want to start?
I think the answer to that would be yes, because work done in anticipation of a threat foreseeable for 5 years would fit into that circumstance, and there's no way to be ready unless you have beds on the ground and equipment to use in there. And I know they're paying for it. They moved 2 naval hospitals to 2 big ports, and I know that's being paid for by federal funds. So I would think so long as you have a legal responsibility to provide that medical care, that you would submit all of the setup costs necessary to go into operation.
Now, let me ask you a technical question, and I'll throw it over to Bill next. At least in California, the health departments generally are at the county level. There are maybe half a dozen cities in California that have their own health department, but most of them turn to the county. Would that then take away that obligation if a city thought they should do a quarantine site? Because technically it's a county health department, not a city health department. What do you think, Bill?
I don't think it changes the equation too much.
Okay.
I don't think I look at this as, emergency protective measures. You take those measures that are necessary to protect public health and safety, and that a local health department or a local authority taking those steps when the county would normally provide that function, I don't think is going to make too much difference in this case. I like to use the analogy of sandbagging for a flood, and it doesn't make any difference with, if you sandbag in anticipation of a flood, it doesn't make any difference whether the flood actually arrives or not. So I think that in this case, those are eligible expenses that should be reimbursed by FEMA.
Properly documented, of course.
Of course.
Chris, any thoughts on that question?
Nope, I agree with the sandbag analogy 100%. But again, just before kind of making your own determination, that those costs are eligible, definitely checking in, with the state and with FEMA to make sure everyone's on the same page.
All right. New question here from the Heartland, my good friend Paul Johnson. Most government workers are involved in the COVID-19 response are also spending some of their time trying to manage and handle other tasks as part of their job that is not COVID related. How much scrutiny will FEMA have on time expended on COVID versus other response activities? And I'm not clear whether that's just other day-to-day work, or if you have a secondary disaster that's happening while we've got COVID on the ground. Chris, you want to lead off on this one?
Yeah, absolutely. I don't think this will be much different than any other disaster, in that you just need to do a good job of documenting specifically what you did. I think FEMA will take your word for it up to a certain extent, but I think you're going to need to provide documentation showing I spent all of my 8 hours today working on COVID related activities. So again, just be prepared to be able to provide documentation should FEMA request it. Jerry,
any other thoughts?
No, similar thoughts, but I would add FEMA's got a list of eligible activities for Category B, and I would certainly record my activities against those particular titles But to answer the opening part of that question is I would expect that not only FEMA, but the OIG will be scrutinizing the assignment of time records considerably, just because particularly for the OIG, it gives them something to do. And they don't seem to care whether they spend more denying it than the amount they're denying. So I would definitely follow on what Chris and Bill have said about careful documentation and thorough.
And Bill, your thoughts, please.
Yeah, and nothing to add. I thought those were two very good answers.
Okay, excellent. Can you provide detailed descriptions of the type of information we need to track for expenditures and recommendations of how to track and document the expenditures in such a way as to maximize the reimbursement? Bill, let's start with you this time.
Sure, and I don't think it's any different than the documentation that you need to provide for any project worksheet on any other disaster. And I like to tell our clients that what they need to do is to tell a story. And you tell that story with a narrative and with all of the supporting documentation. You're going to need that supporting documentation for your grants management. You're going to need to be able to follow it through the system. But really what you're doing is telling a story for someone years from now who's going to be reviewing that project worksheet and reviewing the grant process and is going to be trying to close that PW out, who is not involved in any of it. Years down the road, people have retired, people have moved on, they're not with the applicant any longer, and so it's so important that project worksheet tell that full story in such a way that a person years from now can read it and understand it and make sound judgments at time of closeout.
Excellent. Jerry?
Yeah, the interesting thing about documentation, and Bill is absolutely correct, it's no different than any other disaster. And I shock people when I tell them the documentation requirements have not changed since 1979. If you look at that original documentation requirement, there's only a few words that have changed, and that's used to be damage survey report, it's now project worksheet, and that's all that's changed. FEMA demands documentation by the minute of what you've done, and both dollar-wise and, as Bill indicated, the narrative have to support all of that. So be very thorough when you do that.
And Chris?
Yeah, and it sounds like for a lot of the costs we're talking about, would be maybe internal costs, but I think when you're talking about different contract costs, things like that, be sure to refer back to or be able to point back to your contract and figure out what the documentation requirements are there. So are timesheets required? Are daily work logs required? Are different things like that. I tend to find that pretty helpful.
Okay. What I share with people is what I call the 5 W's. Who did the work? What work did they do? When did they do it? Why did they do it? Where did they do it and how long? If you cover the 5 W's, I think you're pretty bulletproof. If you cover them effectively, you're pretty bulletproof in terms of that source documentation that's so critical. And I think the other thing, as we've talked about earlier, is do not look at FEMA as a first source, but a last source of funding, and to see where else you may be able to not only get funding, but frankly, get better funding. So Federal Transit Authority for eligible transit districts, I understand, is providing 100% for PPE versus 75 cents on the dollar if you get it from FEMA. Department of Justice is doing 100% for PPE for law enforcement, up to the available funding, which is, again, 25% better than what you can get from FEMA. So tracking things is important, but also, and perhaps yet to be seen, more important is getting the funds from the right sources first. So there's a lot to consider here. Oh, and here's just, can we add the list of category B activities to the handout workbook? And I think it's in there. Let me look and see here. That, yeah, on the handout, page 23 is the eligible emergency protective measures handout, which goes 2 pages. So it's a short thing, but it certainly gives you some broad categories. So if you look to that handout, and that's as good as it gets, as far as I know, as of last Friday when I put this thing together. Okay, and we're light on questions today.
Hey, Mike, this is Bill. Can I just add something to what you said about the handout and the list of eligible work under category B?
Absolutely.
Yeah, I think it's important to recognize that the fact sheet that was distributed by FEMA, and I think it says it. I don't have it in front of me, but I think it says it on there that this list is not exhaustive, and that there will be things that are eligible that are not listed there, and that for a more complete understanding of what would be eligible, you need to go into both the Papa G and to 44 CFR and look at what is eligible under category B. And I think that may provide the subgrantees with a better idea of some of the things that they've done that are reimbursable that may not be on that list.
Yes, and for the convenience of folks, although I highly recommend being intimately familiar with the Papa G or the Public Assistance Program and Policy Guide, starting on page 35, there's several pages there that are taken right out of the Papa G that talk about supplies and commodities, meals, and then medical care, and medical care runs on into evacuation and sheltering. All of these things are relevant to the COVID-19. So there's quite a few pages there right from the Papa G, so you don't even have to go look for it. And now, here's another question. Do I understand correctly that CARES Act money given to local jurisdictions can be used to match their local FEMA cost share, and the same action can be used for the state and their cost share? Bill, let's start with you, please. Would you like me to repeat the question?
Oh, there we go. No, I've got it. Thank you. A little trouble on the mute button. I haven't seen anything definitive on that yet, and perhaps it's out there and I just haven't seen it. I think that there has been a lot of talk about certain aspects of the CARES Act being used for the non-federal share, but I have not seen anything yet in writing that is definitive on the subject.
Okay, Jerry?
Yeah, I agree, unless it's got a high-level executive at a FEMA headquarters signature on it. It doesn't matter what we all think, and it's not defendable unless we can point out we have a signed document to that effect. The only federal money that I know you can use is to match FEMA money is CDBG at this point. And that's out in writing and in several FEMA publications as well.
Chris, thank you, Jerry.
Yep, definitely agree with the other panelists. I think when you're using federal money to pay the non-federal share, it just tends to get a little messy and just take some time for a process and guidance to kind of be developed on that. So I haven't seen anything definitive either, and imagine it'll probably be just a bit before we do.
And I don't know that this will be any comfort to any of our folks that are listening in today. I spent quite a few hours last week researching the CARES Act. It's an inch and a half thick when you print it out double-sided and online. And I found that when I go down a rabbit hole at CDC or Health and Human Services or Department of Justice, and it says click here, and it takes me right back to the same rabbit hole I thought I just left. Researching this is difficult, I think, at best. Keeping up with it is difficult at best. And so if you feel overwhelmed, A, you are not alone, and B, you got to keep trying at it, because this is the hand that we're dealt here. Okay, new question. Let's see. Okay, you mentioned FEMA wants to make sure we are not buying more than we need. I'm thinking about hand sanitizer and masks. We are estimating our needs, but may overbuy depending on cases and a possible second wave. Will people pay off of invoices, or will they only pay for PPE that is actually assigned, used, and signed for? Chris?
Yeah, that's a really good question. I think the best thing to do is just really document, what your, what you do use, kind of, where you got it and where it went. I think, what FEMA is going to be looking for in regard to all of this is making sure that there is, in your contract somewhere, some kind of clause for termination for convenience.
Good point. Good point. Yeah, that procurement thing is always hanging in the background. Jerry?
Yeah, this is another one, and Bill's alluded to it earlier, of actually going back to the regulations. Category B, emergency conditions, have a 5-year time horizon. So I don't know that we can think, I hope COVID-19 doesn't go 5 years. And FEMA has provided a burn rate calculator. And I think if you team up the idea of a management decision as to what's a reasonable amount of time for us to estimate, and match that up against your burn rate calculator, that you have some justification for claiming everything that you ordered. I do know that FEMA has in the past paid for only things that are used. And so there's going to have to be a trade-off on that. So I'm not sure there's an easy answer. Just justify your decision as best you can. Put in the whole amount and negotiate for what they're willing to approve.
Bill?
Yeah, I would agree with both answers that were given. It's a little uncharted territory right now, given that it's a health epidemic, a global pandemic. I think that the key to it is going to be the documentation and the methodology that was used to estimate what the needs were going to be, and that you can represent that this was the result of careful planning and not hoarding of resources.
Yes, thank you, Bill. And FEMA's on the watch, the OIG's on the watch for supplies ordered way in excess of what appears to be the need. So to the extent you properly document it and don't overbuy, because they they would love to make an example of you if you're trying to stock up for the next 5 years on masks or other PPE in case something else comes up or FEMA comes back. So let's see, question here. Oh, this is a comment from Paul Johnson that FEMA Region 7 administrator announced it on a conference call last week. Paul, would you just send me a note what you're referring to there? No question. You mentioned FEMA should be used as a funding source of last resort for duplication of benefits, but most of the other funding sources available also state expenses that are eligible should be reimbursed. To be reimbursed should not be start over. You mentioned that FEMA should be used as a funding source of last resort for duplication of benefits, but most of the other funding sources available also state the expenses that are eligible to reimburse should not be duplicated, and the source should be used as a last resort. Layering of funding sources is key, but we have 2 funding sources that may find an expense eligible. How do we determine which source trumps the other? No pun intended. Bill, do you want to take a stab at that?
Sure, I'll take a stab at it. And I think I alluded to it in some earlier comments that, there's specific authority and there's general authority, as I like to put it. And under the CARES Act, there's general authority to provide benefits. There's also a limitation on what that benefit of the pot of money that's available for that benefit. And it's a little bit different than duplication of benefits, because although there might be 2 sources of funding, because one is under a general authority and the other is under a specific authority, if you're unable to get the funding under the general authority, then the agency, FEMA, that has specific authority to provide funding in that case, and if you meet the eligibility requirements, they are required to fund it. I think that you draw the line of difference there. I don't know if that makes sense, but and a follow-up question on that, maybe to clarify it, would be helpful.
Chris, your thoughts?
Yeah, I mean, I definitely agree with both panelists there. I don't think I have anything further to add to that.
All right, and Jerry?
Yeah, I think Bill's right. FEMA is of longstanding the provider of last resort. I think the duplication of benefits amongst CARES agencies is you can't claim the same cost across multiple boards. But I'm glad you came back to this question, because one part is showing that you attempted to get money from DOJ or some other piece of CARES, and either you ran out of money or you were denied, and then you use that to defend your FEMA claim. I have DOJ clients, one of whom isn't sure they can spend their allocation, the other one that has already exceeded their allocation. So we're going to have costs that lay back to FEMA as the provider of last resort. But again, it goes back to what all 3 of us have said, is documenting your pursuit, documenting what you did, document what you asked for. And if you're denied, document the denial and then take it to FEMA.
Okay, very good. Thank you, gentlemen. If county employees end up working overtime 2 days a week because they had to spend time on COVID-19 on the other days, is that overtime reimbursable, or can it be counted as donation? What would adequate documentation for this cost look like? Chris?
Yeah, I'm a little confused on the question, but I would say that only the COVID-related overtime would be eligible. Yeah.
And I think, if I'm not mistaken, you would consider their normal workday the regular time, and the overtime would all be pushed into COVID. Jerry, would you agree with that?
Absolutely. I was going to say reorganize the schedule.
Yeah, yeah. Regardless of what your time card is, that overtime is going to go to COVID. Bill?
Yeah, I'm going to come back to documentation, and I think you're going to need to carefully be able to demonstrate with the documentation how you arrived at that. And I think you're also going to need the backup of personnel policies for the particular applicant.
Yeah, I think you just touched on something that's really important, Bill, is having policies and procedures in place prior to the disaster. I got this e-signature policy from a client a couple weeks ago, and the beauty of it is it's been around for 3 years. This is not something they made up, after January 21st, when this thing started to roll. It's been around for a long time, and when you've got these existing policies and procedures for a variety of things, it makes your position so much more defensible, because you're not doing this now just because it's a disaster. This was your standard practice existing long before the disaster occurred. So I think that's very important. I thought I heard on a conference call that our FEMA regional administrator announced that CARES funding may be used as the non-federal match. I am now wondering if I heard correctly, since your panel is unaware of that. And Paul is from Region 7, I believe. I throw this one open to anybody on our panel.
Well, Mike, if Paul can get that in writing and have somebody from C Street Southwest endorse it, then all of IAM needs a copy.
Great. Yeah, absolutely. Absolutely. Okay. New question. In the CARES guidance, it states payroll expenses for public safety, public health, healthcare, human services, and similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency are eligible. It also says that costs not accounted for in the budget most recently approved as of March 27th, 2020. Most staff is going to be in the budget. Are these payroll expenses still eligible? Jerry?
Still eligible in which program?
Yeah. Well, argue. Well, yeah. And I've seen that language in my review of some of the CARES Act funding. It says whose services are substantially dedicated, and that's in the CARES Act, not in FEMA public assistance, because FEMA public assistance, in my experience, is going to want very specific details, whereas in some of the COVID or CARES Act, it's a broader brush. Bill, any thoughts?
Well, I think it points out the need to be very strategic in the types of funding that you're pursuing and what you're pursuing it for. And that, while some of those costs would not be eligible under FEMA public assistance, they may be eligible under the CARES Act, and strategically, if there is a difference in the eligibility, then one would go to the CARES Act to seek reimbursement for those funds.
Chris, your thoughts?
Yep, totally agree with that. I think it's all about being strategic when it comes to get reimbursed for payroll expenses.
Okay, thought I had another question, but whoops. Misty, would you send me that question again? I accidentally hit delete. I apologize for that. We are just about to the end of the hour here. I'll give Misty a second to see if she's going to resend that question. In the meantime, I want to remind everybody that Thursday of this week, 2 days hence, IAEM and Witt O'Brien's are going to sponsor a webinar specifically on the CARES Act. So they're not going to be talking about FEMA public assistance. They will be talking specifically about the CARES Act. They've got an excellent panel. And if you think your agency may qualify or should qualify for any kind of CARES Act funding, I would highly encourage you to join on that call. And that's Thursday. I believe it's around the same time, 1 o'clock Eastern. So obviously 10 o'clock Western, and you got to interpolate for the rest. And our host, Miss Harshman, had an emergency, not a dire emergency, but something that had to be attended to, and had to leave the call. So with that, does anybody have a bolt of lightning that they want to share before we hang up? Oh, okay, here's that question from Misty. Let's see if we can do it something. Okay, that was the question that we had, and we've addressed it. So with that, we will close the webinar a minute or two early, and you've got on your screen there the resources that are provided by IAEM, and these are available to everyone. It's not limited to membership, and for that we want to thank IAEM for the generous contribution of web space. And with that, I'd like to thank our panelists, Bill Riley, Jerry Quinn, and Chris Terry. And we will do one more of these scheduled. We have one more scheduled for June 9th. And with that, I'll bid you all a good day and good cost recovery. Thank you.